Hey guys, this is Ishwar. This is going to be a quick video about factors influencing healing. Now, healing is a very complicated process, but I'll break it down to you in the following videos. Now, factors influencing healing is of two types. There are localized factors and there are systemic factors. Now, among the localized factors, the first factor is infections. Now, if you have an underlying infection, then your healing will be inhibited because all its resources are used for the infection at hand. Second, blood supply. When there is poor blood supply to an area that is injured, then obviously there is going to be very delayed healing. How you might have noticed how facial injuries heal very quickly. This is because of very good blood supply to the face and in the oral cavity as well. You bite your lip, you cut off a little bit of your gum while chewing, it heals very quickly. This is because of good blood supply. And foreign bodies. If the third is foreign bodies. If you have an injury in which there is some sort of, let's say you fall in the ground and there's some asphalt, this delays healing because the foreign bodies act as antigens and they form sensitivity and hypersensitivity reaction that cause additional complications. Now, movement is the fourth factor. You might have heard your orthopedician tell you to not move your hand while you are restrained with a plaster on your hand. This is because the bones or the injured tissue needs to stay in a relatively sound state so that it can actually form the layers which are required for healing. The fifth is ionizing radiations. Now, it has been seen that ionizing radiations tend to delay granulation tissue formation. So, on exposure to ionizing radiations, your healing is delayed. Factor 6 is ultraviolet rays. Now, quite opposing to ionizing radiations, ultraviolet rays increase the speed or pace of healing. And then the last or seventh one is type, size, and location of the injury. Now, if the injury is deep or if it spans a lot of area, then it will take a lot of time to heal. And the location, of course, as I already told you, the blood supply is important, and it also depends on if any vital organ is hit or how bad the injury is. Now let's move on to systemic factors. The first most important systemic factor is obviously age. Younger people have a better chance of healing quicker because their bodies are new. Yes. And as you age, the cells undergo apoptosis and they lose their potential to heal. Not that you won't heal, you'll just heal slower. And then the second factor is nutrition. Now, there are some nutritive factors that are responsible for healing, like vitamin C. Now, these are all required for your healing. And if you are deficient in any such nutrients, then your healing will be slow. Then, moving on to systemic infections. Now, if your body is already suffering from a systemic infection that either causes bleeding disorders or delayed clot formation, then this will hinder your healing properties. Your fourth factor is administration of glucocorticoids. Now, an effect of glucocorticoids is that it is immunosuppressive in nature, and with a suppressed immune system, it is very difficult to heal because of the lack of activation of platelets, or it could be due to the lack of activation of cytokines and macrophages, which are required to kill off the antigens which might have entered through the injury. And the fifth one is uncontrolled diabetics. The thing with diabetics is insulin doesn't just regulate the blood sugar level and stop there. It also plays a hand in metabolism, even in bleeding, clotting, clot formation. So if you are an uncontrolled diabetic, then the healing or the clot formation will be comparatively slow. And then there are certain hematologic conditions like hemophilia, which delays your clot formation and causes prolonged bleeding. And then there are diseases like sickle cell anemia, which delays clotting on a whole, if not in particular. Then there are conditions like thrombocytopenia, which cause a decrease in the number of platelets. So this also reduces the speed of clotting. Now, we discussed seven types in local factors and seven types of systemic and six types of systemic factors. Hope you keep this in mind. Hit subscribe, hit the like button, and stay tuned for more.